Scabies is a transmissible skin disease characterized by relentless itching and angry rash. The itching and rash associated with scabies are as a result of the body's allergic reaction to the mites, their waste, and their eggs. It is highly contagious and can spread very easily from person to person.
Scabies has an etiology. Scabies is caused by the mite Sarcoptes scabiei var. Hominis, an obligate human parasite that lives in burrowed tunnels in the stratum corneum. So this scabies is easily transmitted from the person to person through physical contact like animal and fumite transmission, probably also occurs. So the primary risk factor is crowded condition like in the school, shelter, barracks, and some household. So there is no clear association with poor hygiene. So for unknown reason, crusted scabies is more common among immunosuppressed patients like those with HIV infection, hematologic cancer, chronic corticosteroid, or other immunosuppressant use. So the patient with severe physical disabilities or intellectual disability and Australian Aborigines infestations occur worldwide. So the patient in warm climate develops small erythematous papules with few burrows. So severity is related to the patient immune status, not the geography.
Signs and symptoms of scabies. Itching, mainly at night. The itching is the most common symptom. The itch can be so intense that it keeps a person awake at night. Rash. Many people get the scabies rash. This rash causes little bumps that often form a line. The bumps can look like hives, tiny bites, knots under the skin, or pimples. Some people develop scaly patches that look like schema. Sores. Scratching that itchy rash can cause sores. An infection can develop in the sores. Thick crust under the skin. Crust form when a person develops a severe type of scabies called crusted scabies.
Diagnosis of scabies is based on the signs and symptoms by examining the skin or carrying out the skin scraping test. It sometimes physician will scrape one or more bumps open. They will inspect at scrapings under microscope to see the mites.
The scabies is a highly contagious and can spread very easily from person to person. The mode of transmission is through a close skin contact with an infected person, such as sexual contact among sexually active person or through hugging. Scabies sometimes can be spread by contact with items such as clothing, beddings, or towels that have been used by a person with scabies. But such spread is very uncommon unless the infected person has crusted scabies. Okay, so it is estimated to affect over 300 million people each year throughout the world, and it can affect of all ages, race, and gender. A more severe case is the crusted scabies that typically occurs in people with weakened immune system.
So how is scabies treated in children? Your healthcare provider must order a cream that contains a medicine called permethrin to treat scabies. The cream is applied to your whole body below your head, including the hands, palms, and the soles of the feet. In children with scabies, the cream may need to be applied to the scalp. Be sure that the skin is clean, cool, and dry before applying the cream. Permethrin cream is left on the skin for 8 to 14 hours and then washed off. The cream is most often applied at night and washed off in the morning.
How is scabies treated in adult? Ivermectin is another option of treating scabies. This is antiparasitic pills given in a single dose, followed by second dose 1 to 2 weeks later. But if you're pregnant and lactating, you should not use ivermectin. Your provider might also suggest antihistamine, which can be given by mouth and as cream to relieve itching. Your provider will also treat any type of infection that may be present. People who have severe case of scabies or a weakened immune system may need to take medicine by mouth.
Infestation with scabies is curable. An individual with scabies, when correctly treated, has a good prognosis, and both the itching and eczema should resolve. Scabies infestation may be complicated by bacterial infection, leading to the development of skin sores that in turn may lead to the development of more serious consequences such as septicemia, heart disease, and chronic kidney disease.
The only way to keep scabies away is to avoid prolonged and direct skin-to-skin contact with the person who has them. You also want them to avoid touching items like bedding or clothing that the person has used. If you or something in your home has scabies or has been exposed to it, seek treatment right away. Also, kill mites on your clothing or things by washing them in hot water and dry them in a hot dryer. Have them dry cleaned or put them in a closed plastic bag for at least 3 days so that the mites will die.